So when it comes to introducing solid foods, parents often ask us what sort of texture should they be starting with. Now, it's important to remember that all babies are different. So some babies might be really excited to get going and will accept a wide range of tastes, textures and flavours from the beginning, and they may even want to feed themselves from the start. Other babies might be a little bit more reluctant and need more encouragement. So for these babies, it may be good to start with a smoother texture or more well-meshed texture food on a spoon. Some families like to follow more of the baby-led weaning approach, which refers to giving soft cooked foods to baby in whole pieces and allowing babies to feed themselves. Lots of families like to adopt a mixed approach to offering some foods on a spoon alongside finger foods. There really is no right or wrong way. Do what feels best for you and your baby. The most important thing is that babies are introduced to a wide range of tastes and flavours. So if you haven't already, by the age of 7 months, try to make sure that you have introduced babies to some lumpy foods and finger foods. And that's because this is really the perfect opportunity to introduce new skills such as biting and chewing. We know that by delaying the introduction of lumpy foods, it's actually harder for babies to accept these textures later on. You might find as you start to introduce lumpy foods, meal times might take a little bit longer and babies might start to eat a little bit less than you're used to. But that's okay. Remember, it is a new skill and practice makes perfect, so keep offering lumpy textures. Don't worry if you do notice that your babies are coughing and gagging a little bit when you're introducing lumpy foods. That's because the gag reflex is very far forward on the tongue. The more exposure that babies have with lumpy foods in their mouth, the further to the back of the mouth the gag reflex will move. If you do notice that babies are coughing or gagging a little bit at meal times, try to stay nice and calm and relaxed. Give babies a little bit of reassurance and just continue with the meal time. Don't go back and offer babies smooth texture food thinking they're not ready. As I said, it's a new skill and it takes time for them to learn and practice. The more exposure they have with lumpy foods and textures in the mouth, the more they'll be able to manage. So try to start introducing a range of finger foods to baby 2 at this time. Now, finger foods are perfect because not only does it encourage children to feed themselves, it encourages an interest in food and it's supportive of their hand-eye coordination. Finger foods should be about the size of our finger so that babies are easily able to grip hold of them and bring them to the mouth. They should be nice and soft. So a good test is if you can break the food between your thumb and your forefinger, you know that babies will be able to manage that. Don't worry if babies don't have any teeth yet because the teeth are just under the gums and they're well able to bite and chew the soft finger foods that you'll provide them. Always make sure that you're sat with your baby at mealtime so that you can assist them if they do get into any difficulty. It's a good idea to eat with them because babies love to copy us and they'll enjoy watching you bite and chew your food and they'll be learning from you at the same time.